RCP 113, Section 3 of Objectives for Midterm. 1. Describe how the heart, lungs, and kidneys work as a unit. The heart pumps oxygenated blood to the tissues. Tissue hypoxia secondary to lung disease will cause compensatory increase in cardiac output. Sustained elevated cardiac workload will lead to cardiac disease that will in turn cause decreases in kidney perfusion. Impaired kidneys will lose the ability to regulate fluid balance properly, leading to further cardiac and pulmonary disease. 2. Name 3 components of cardiac system: heart, vessels, and blood. 3. Describe the difference in right and left heart function. The right heart receives deoxygenated blood from the systemic circulation under low pressure. The right ventricle sends blood to the lungs, also under low pressure. Left heart receives oxygenated blood from the lungs and sends to the systemic circulation under high pressure. 4. Name 2 properties of the heart: electrical and mechanical. 5. Define chronotropic, inotropic, and dromotropic. Chronotropic relates to the heart rate, (chrono equals time). Inotropic relates to contractile force. Dromotropic relates to the speed of electrical conduction. 6. Describe ions responsible for depolarization and repolarization. That would be potassium, or K, moves in and out of the cell opposite to sodium, or Na, to change action potential before and after contraction. Calcium, or Ca, acts on actin and myosin to regulate muscle contraction. 7. Define ECG and name waves of conduction. ECG, or electrocardiogram. It's the recording of the heart's electrical activity. P wave, atrial depolarization. When you hear depolarization, think contraction. QRS complex. That's ventricular depolarization. T wave, ventricular repolarization. Ventricles at rest, preparing for the next contraction. When you hear repolarization, think relaxation. 8. Define automaticity. It's the ability of a cell to provide the pacemaker stimulus. 9. Name the 2 types of arrhythmias and know types of each. Supraventricular, and types would be sinus bradycardia and atrial fibrillation. The second is ventricular. Types would be ventricular fibrillation and ventricular tachycardia. Number 10 is X'd out. 11. Describe heart failure. Condition in which the ventricles cannot pump enough blood to supply the body. 12. Name and identify drugs used to treat heart failure. This is from my own class notes. I have dopamine, nitroglycerin, and oxygen. 13. Define angina.
Not to be confused with mangina.
And its treatment options. Angina is chest pain. From my own notes, it's caused by inflammation and lack of oxygen. I have parentheses hypoxemia. We would treat that with oxygen. In Mike's notes, he also adds the treatment options: beta blockers and calcium channel blockers. 14. Name 2 conditions of acute coronary syndrome: unstable angina and myocardial infarction. 15. List risk factors for ACS, diabetes, and hyperlipidemia. 16. Describe the 3 reasons cardiovascular systems must be pressurized. Vital gas exchange. 2. Nutrients. And 3rd, immunological defense. 17. Name the 2 parts of the circulatory system: pulmonary vascular system and systemic vascular system. 18. Name the vessels associated with both parts of the circulatory system. Pulmonary includes pulmonary artery, pulmonary veins, and capillaries. Systemic includes vessels throughout the rest of the body. Both of those contain arteries, arterioles, capillaries, venules, and veins. 19. Name 3 substances that control the contraction of smooth muscle tissue. Prostacyclin, which is a vasodilator; endothelin, which is a vasoconstrictor; and nitric oxide, another vasodilator. 20. Define preload and afterload and the mechanisms of action. Preload: amount of blood returned to the heart and in vessels before a contraction. Afterload: it's the force against which the heart must pump. 21. Define blood pressure equation and its parts. BP equals cardiac output, parentheses CO, times total peripheral resistance. We have parentheses stroke volume times HR, in parentheses, times condition of the vessels, also known as the squeeze. We have another parentheses, volume of blood pumped in a minute, in parentheses. 22. Define hypertension. It is an elevated systolic blood pressure, diastolic, or both. It would be greater than 140/90. 23. Describe lifestyle modifications employed in treating hypertension. Increase of exercise, decrease in weight, decrease in alcohol consumption.
Oh boy.
A decrease in smoking or quitting, and a decrease in salt intake. 24. Define how sympatholytics are used to treat hypertension. Sympatholytics decrease heart rate, vascular resistance, stroke volume, cardiac output, and cardiac contractile force. 25. Define the 3 drug classes used to treat thromboembolus and examples of each. 1. Anticoagulant. It prevents fibrin clot formation, parentheses, heparin and warfarin. 2. Antiplatelet. Prevents platelet aggregation, parentheses, aspirin and clopidogrel. 3rd. Fibrinolytics. Dissolve fibrin clots, parentheses, alteplase and tenecteplase. 26. Describe how anticoagulants are distinguished and know examples of each. You have direct thrombin inhibitor. Examples are lepirudin and argatrobin. Second, you have indirect thrombin inhibitor. Warfarin and heparin are examples. End of section 3 of objectives for midterm.